Less than 3.5% of Africa's population is fully vaccinated. The biggest hurdle now is the lack of access to the vaccines, and according to the African Union Special Envoy on COVID-19, not purchasing power.
We call on those countries that have put restrictions on exports of vaccines as finished products, exports of ingredients, drug substance. These restrictions are even more urgent for us today than intellectual property, because the intellectual property doesn't deliver a vaccine to us tomorrow. But an export ban lifted in the United States, in Japan, in China, in Korea, South Korea, India, that will give us vaccines immediately.
The World Health Organization recommitted its support to African member states to ensure that each country is ready for mass rollouts when supply becomes steady. The UN agency and its partners have again called on manufacturers and rich nations to prioritize the continent.
That's why last week we called on governments to recommit with further action. Join us in telling manufacturers to make the supply schedules transparent so we know where COVAX and its participants are being prioritized. For countries to give up their place in manufacturers' queues if they've already achieved high levels of coverage and don't need vaccines at that point. And to expand, accelerate, and systematize dose donations so we can put excess doses to good use.
We call on all countries and manufacturers to share information on bilateral deals with COVAX and ABAT so we understand where vaccines are needed most, and to share information on supply and delivery projections so countries can be ready to immediately roll out vaccines when they land. And we call on all countries to recognize all vaccines with WHO emergency use listing. I may sound like a broken record. I don't care. I will continue to call for vaccine equity until we get it.
To get Africa at 70% vaccine coverage by the end of 2022, $300 billion is needed in funding. The UN Economic Commission for Africa says member states will still need to be granted drawing rights.
We hope that we can get the international community to continue to on-lend special drawing rights so that we can create a vaccines facility to be able to respond to what is now seemingly going to be a continuous spend for the continent. The continent has worked really hard to ensure that its macroeconomic balances were solid. Some countries were reaching debt distress levels. The COVID-19 virus is clearly going to throw them across the board.
Afrexim Bank will continue being the financing partner for the AU vaccination acquisition mechanism. Nama Polani, SABC News.